Hi guys, good time of the day. We got a lot of questions about Omicron. What is it? What can you do? And what's our advice? As you know, Omicron is a new variant and it has a lot of mutations. In this video, we were going to talk about how is it different and what are the practical things that we see and we can recommend.
Hi, my name is Roger Stanley. I've been coming to see Dr. Margolis for about 8 months, and he's been taking well care of me. Without him, I don't know what I would do because I'd be in too much pain to live comfortably, and he helps me live comfortably.
My name is Alice Connor, and I've been coming to Dr. Margolis for about 6 months now. He's very tremendous. He helped me get my back better. I've been having pains in my lower back, and now it's very good, and I can do things I couldn't do at first.
My name is Galina Fragina. I come to the Dr. Margolin for 3 years. He helped me a lot.
Hello, I've been coming to Dr. Margolian's for 9 years, and before that, I struggled with pain. I have a rare disease, and he is excellent and knowledgeable about everything. And I love the clinic. I love talking with him just about everything, not just only the pain, but he's knowledgeable about medicine, vitamins, and he's just did me wonders.
Well, from the clinical point of view, I think two features that you most probably heard about is that Omicron variant is much more infectious. It's spreading much faster, and we even see that countries with rigid rules and lockdowns and regulations, like parts of Europe, Israel, maybe some other countries, they do not necessarily in better shape than countries with more lenient and less rigid regulations, because the virus apparently breaks through immunization, even with a booster. We hope that immunized people, have much less chances to go to the hospitals. And it seems like that the best shot, the best course of action is to be in the best shape and prepare yourself as much as possible in case you're infected or you're around or you're taking care of the person who is infected. How you can do that? Well, first, please watch our videos from a year ago about supplements, about boosting your immune system. And even before we start talking about different supplements, I think the basic things like good nutrition, avoiding sugar, junk food, minimizing or avoiding alcohol, maybe cutting on red meat. As we discussed, more plant-based nutrition, not necessarily being vegan or vegetarian, but just healthy nutrition, healthy food, 20 minutes of exercise a day. And some people use other modalities like infrared sauna, like contrast shower, and so on. What we discussed a year ago, it's perfectly applicable to that. You want to be in the best shape physically and best shape in terms of your immune system before you meet the virus, right? You want to have high normal levels of vitamin D. You want to test your vitamin D. You want to be between 50 and 70 using American units, meaning high level of normal vitamin D. Mayo Clinic says you can supplement between 2,000 to 5,000 units of vitamin D3 daily. Usually, if you don't know your levels, you can talk to your primary doctor. Some people use zinc, quercetin, vitamin C, vitamin E, and so on. We discuss it. What is maybe unique to Omicron, except for high R ratio, high level and high speed of infection, is the involvement of upper respiratory tract. Many people describe it as bad common cold, and primarily sinuses and nose, and something we did not mention in the past, and that's why I want to mention it now, is sinus rinse or nose rinse. When we deal with upper respiratory infection, some people tend to use this, offering a variation of this, which is a Vasoconstrictor Drops, which temporarily relieve common cold symptoms, discharge from nose. It has to be used with caution. It can help temporarily, but if you use it repeatedly and cause necrosis of the tissues and actually increase discharge from the nose and even nosebleed. That's why you want to use regular nose rinse or sinus rinses instead. I recommend using prefabricated packages. Use only distilled water. Wash your hands. You don't want to get additional infection. You can do it several times a day. Some people prepare the salt and the solution themselves. I do not recommend it. Some literature talks about 2 or 3 teaspoons per 8 ounces of distilled water. Use it with caution. I, under no circumstance, recommend experimenting with Himalayan salt or Dead Sea salt or any kind of unusual salt, because some people are very sensitive and it can cause swelling of the tissues, which is very dangerous. But regular standardized solution is fairly safe. That's number one. Washing the nose. Number 2, respiratory exercises. We mentioned it in our first publication, primarily for people who have cough or have what people usually describe as bronchitis. If you take a plastic bottle and you take a straw and you fill it with water and you inhale through the nose and you exhale through the straw through the water. Some people do it while laying down on their chest. That negative pressure keeps your alveoli open. Do it regularly. It's a good exercise if you have the virus. And the last option, which is debated in the literature, and there is no official recommendation for or against it, but I still want to mention it. It's a medication called fluvoxamine. It was studied and published in Lancet, I think in October, that it may decrease your chances of getting to the hospital. It's a cheap medication. It's originally antidepressant, but it used different dose and different protocol. It used to decrease inflammation in your body. It's called Lulax in the United States. It's a very cheap medication. I can't recommend it. I can only recommend to ask your treating physician about it. But I've seen people who took it and it was well tolerated and possibly efficacious. So these are just some ideas. And obviously, control your stress. Not only it will help you to make good decisions during these challenging times, stress control actually enhances your immune system and helps you to fight the virus. And I hope everybody stays healthy, and we're going to make it just fine from this wave of Omicron. Thank you. Hi, I'd like to show you how to rinse your nose. Again, as I mentioned, it's better to use prefabricated set rather than to mix salt and water yourself. Some publications recommend 3 teaspoons of regular salt without any additives mixed with distilled water. Some add baked soda. I do not recommend it. I recommend only prefabricated solutions. Remember that your sinuses and your inner ear may be connected, and that's why in order to prevent fluid going into your ear, you need to lean to bend your neck and to say k, like you're saying the word ki, k, k. That will close your ears. You put the bottle into one nostril, you squeeze it and let it go, and the water comes out from the same nostril or from the other nostril. Let me show you. That's it. We wash the nose.